Hello everybody, my name is Chris Coogan and I want to thank you for clicking on the link and watching this video about our program. I'm the program director. I've been the program director for about the last 10 years. I did my residency at Rush. I left and did an oncology fellowship at Indiana University. I've been back at Rush since 1996. It's amazing to me the changes that have occurred during my career at Rush in both the caliber of the residents, the difficulty and the amount of surgeries we've done. Our residents are getting the fellowships that they want. Those that want to go into private practice are getting the jobs that they want.
Can't tell you how excited I am to have the opportunity to tell you what we're doing with our program here with respect to resident education. Our training program affords the best training, in my opinion, in the Midwest, maybe the country, for exposure to all facets of urologic surgical skills, as well as the autonomy needed so that you can practice either in private practice or get the fellowship that you want.
I have a unique perspective, having graduated from this program and coming back as faculty. I feel like my residency at Rush University Medical Center gave me excellent training and gave me a strong foundation in many aspects of urology. And I think that I'm able to really improve upon an already great experience and work with our future residents.
I think what separates us from other programs is a high clinical volume and unbelievable independence in the residencies and their training. They really learn how to be critical thinkers. They learn how to make decisions in patient care. They also learn some of the soft skills in urology, how to deal with difficult patients, how to manage difficult problems, how to manage when outcomes aren't exactly the way you would hope they would be.
Residents at Rush are extremely engaged in developing quality improvement projects, research projects, podiums, manuscripts. One of my passions in cancer, we're developing new ways of diagnosing and treating prostate cancer. And one of the nice things is that the residents get to be there on the ground and learn these exciting new technologies from the ground up.
As you go along in residency, you have progressive independence, and we really focus on letting the residents make decisions in and out of the operating room, and so that you really feel prepared when you go into practice or you go into fellowship to take ownership of your patients. And at the same time, we have a definitely work hard, play hard culture. Everyone is very nice. Everyone gets along really well. Everyone's very supportive. You know, I consider the people that I did my residency with here some of my lifelong friends.
I think the Rush Urology program is very strong in terms of the clinical volume and the diversity of clinical cases that come through.
I've been very pleasantly surprised at how self-sufficient and autonomous the residents are and how comfortable they are taking on a wide range of pathology and seeing them progress and teach each other has been very, very special and exciting to be a part of. The amount of time we spend doing didactics, I think, is very efficient. Our weekly grand rounds and tumor boards really pack a heavy punch, but allow for us to really focus on improving our clinical skills as well.
I am so incredibly lucky I matched here at Rush. I think Rush in and of itself shows every day that community is really at the center of it, whether it's about the patient population that we serve, being able to maintain an academic sphere, and definitely being able to incorporate some of those greater needs that are needing to be met in the community.
Rush is very unique in its commitment to the community here on the west side of Chicago and in the Chicago area generally. And it's really more than just talk. They really are an integral part of the community here and really committed to diversity, to health equity, and really to help support and build the community generally.
During the pandemic, we really saw this come into play with all the work that Rush leadership did around the city, working with the governor, getting out into the community to do a lot of vaccine work. And so, that's not a primary urology work, but as urologists, we see a really diverse payer mix, a lot of folks on public insurance and getting public support. It's not your typical private hospital, so we really serve a diverse patient population, which is a really wonderful experience as a faculty member provider, and I think really great for the residents as well.
Life as a resident is always very busy and exciting. Being able to engage with both patients and the rest of the house staff and faculty on a day-to-day basis, you can very much tell how incredibly invigorated and excited people are to work here and engage with the patient population.
We spend a lot of time together in our workroom here, but we also love to hang out outside of the workroom too. We are infamous for our weekly hangouts that often include other programs like our Gen Surgeons, our IR friends as well. We have a very popular place we like to go for pizza, beers, trivia. You can find us at the beach or on the lake any weekend.
The culture at Rush Urology really is one big family. We take care of each other. We work very hard. We're there for each other during the workday, and when work is over, we care for each other just as much as we care for our patients. And it's been an amazing community to be a part of, and I'm grateful for it every day since I started here.
So I moved to Chicago when I started working at Rush, and I really loved it. I have 2 kids. I take them to parks all over the city. They love going to the Museum of Science and Industry. They love going to the Art Institute, Grant Park, Maggie Daley Park. There's a lot to love in Chicago. I'm sure you hear about the restaurant scene all the time. And it's a really nice place to raise a family.
You have all the things that you would get out of a big city, amazing restaurants, super walkable, basically everything that you could need, but with a Midwest feel, so people are nice, it's clean, it's relatively affordable, especially on a resident salary. It's in the middle of the country, so easy to get to the East Coast and the West Coast. I think it's the perfect place to do your residency.
Thank you so much for taking the time to watch this video and learn more about Rush Urology. We are really excited for the next round of applications and meeting all the folks out there who are interested in applying in urology. So hope we get to meet you on the interview trail.
I'm Sean Saitia, and I can't wait to work with you.
I'm Shane, and I am excited to learn and grow with you as a physician.
I'm Dr. Reese, and I can't wait to work with you and see you develop as a urologist.
I'm Morgan. I can't wait to meet you, to work with you, and to show you all our program has to offer.
I'm Morgan Salkowski, and I can't wait to answer your phone call at 2 a.m.
I'm Spencer, and I can't wait to hand you the pager.
I'm Dr. Glazer, and I can't wait for you to tell me in the lounge when you're done with the case that you've done skin to skin by yourself.
My name is Chris Coogan, and I can't wait to watch you put up your first stent in your first couple weeks as an intern here in urology. Have a great day.